Live, this is South Florida Today on NBC6 HD.
All right. Hey, are you embarrassed to take off your stilettos or your slippers because you suffer from smelly feet? You're not the only one. Specifically in the summer, the excessive sweating can inflame your foul foot odor. Well, good news that Dr. Dean Dorfman is here to tell us about how you can prevent and, more importantly, treat the stinky feet.
Right.
Doctor, welcome.
Thank you.
Is this something this happens to, everybody perspires, right? Especially here in South Florida with the summer. So maybe there's some people some of our viewers are thinking, hey, what can I do? I do have this problem. So what can we do?
Okay, well, there's various things you can do. It starts out with good hygiene. So we need to make sure that they wash very well, dry well between the toes. There are powders that can be used inside the shoes to help keep the perspiration down. There are also astringents that can be used that have aluminum chloride, zinc chloride, magnesium chloride in it, and what they can do is they can keep the perspiration levels down. But the most important factor is the shoes. Okay. You definitely have to make sure that you rotate your shoes, wear well-ventilated shoes, meaning that they have pockets for air.
Okay, so what do you look for? Like, for example, is this I would assume is a ventilated shoe,
That's a
right?
ventilated men's shoe, and it's made out of leather, which can breathe. Some of the plastic shoes that are out there, or the rubber shoes, they don't breathe. They don't allow the foot to perspire and absorb the perspiration. This sock here that we brought has a copper lining in it, and the copper inside the sock actually absorbs the perspiration and also kills some of the bacterium. So the key is the sweat plus the bacteria causes a waste product, and that waste product is where the odor comes from. So we want to try to eliminate the bacteria and limit the amount of sweat.
Okay, and we could do that, like you said, with the different powders and soaking solutions. Going back to the copper inside the sock, is that something that you look for on the label when
Yes.
you're buying socks? Because I would have never thought about that.
Some new companies are actually sewing or meshing in copper in there, and copper's been found to kill bacteria and fungus. Fungus is another thing we haven't even touched on, but fungus can get inside the shoes and infect the toenails and the skin, causing peeling and splitting of the skin, but also discoloration of the toenails and yellowing of the toenails, which is a big problem down here in South Florida.
Okay, and if that's the case, you got to go right to your doctor, right?
You have to go right to the doctor. Yeah.
Okay, and then I guess there's different treatments for that. That's a whole other segment.
That's absolutely.
Okay,
yeah.
and I guess for the ladies, that pedicure often or regularly rather, that's something that they need to watch out for as well, because that was also a problem.
Correct. Yeah.
Not too long.
Yeah, there's issues with pedicures to make sure that they're a clean pedicure and the sterility is up to snuff.
Well, speaking of the fungus in the shoes, going back to that, is that where this contraption comes in?
Yeah, it's called a steri shoe, and what it is, it's an ultraviolet light. And what happens is you can take that, it looks like a little shoe tree, and you can actually put that inside the shoe.
So
and
like this? You
just put it in there, and it plugs into a typical AC adapter, and in 40 minutes it sterilizes the shoe. So what it'll do is it'll actually kill all the bacteria and fungus, about 99% fungus and bacteria in there. So when you put your foot into that shoe, you can feel assured that there's no fungus or bacteria that can reinfect your foot. And that's a critical issue.
Okay, and how often should one do that with their shoe?
They can do it once, and then anytime they wear them, what they can do is just put it into the shoe, leave it on the shelf, let it sterilize, and then know the next time they're wearing that shoe, it's a clean, sterile shoe. Especially down here, a lot of people wear shoes without socks. So they're putting their foot into a bed of fungus and bacteria every time they do that, and they wonder why they keep getting reinfected. And the problem usually is the culprit of the shoe, because we're perspiring in the shoe, maintaining that sweat and bacteria in there, and then you're putting your foot inside that cesspool.
And that goes for gentlemen, for ladies as well, that like to wear those closed-toe pumps. Finally, what's this product?
That's a less expensive alternative. It's a shoe spray. That company makes a antifungal shoe spray and antibacterial shoe spray. So similar to the ultraviolet light, it'll kill a lot of the fungus and bacteria on contact. The UV light is a little bit better because it doesn't undo the glues, and some expensive shoes you don't want to be spraying chemicals inside the shoe on a regular basis.
And what's the price of the UV light?
They're about $129.
Okay, but living down here in South Florida, that's something that you want to make sure that you take care of your feet. So that's
absolutely. We see so much. The sweaty feet is one thing, but the fungus is a real problem down here, and fungus toenails have become a tremendous problem. And there are treatments now that we're using with lasers now to actually kill it, so they don't have to take these very dangerous medications that are out.
And real quickly, doctor, within 30 seconds, for somebody who does severe cases that they suffer from sweaty feet, what's another alternative for that?
Okay, so some of the alternatives are Botox injections have become popular. They can decrease the sweating if we can find the actual glands and inject them. And then the nerve that comes into the feet, the autonomic nerve, sometimes it can be severed to keep the sweating from developing in the feet. So those are a little more radical procedures, but work in people that have hyperhidrosis or excessive sweating.
Yeah, they might need to seek that alternative. Well, doctor, thank you so much for all of that information. Very interesting. If you'd like to ask Dr. Dorfman any other questions yourself, or send him, or if you have any questions that you'd like to direct with him personally, send him an email at drdeandorfman@eastoceanpodiatry.com. And doctor, is there a phone number we can contact you at?
Yes, it's 954-481-3525.
All right, doctor, thank you so much.
Thank you.
Pleasure
Appreciate it.
having you. Thank you so much. Nathalie, over to you.